Welcome all of you to Compliance to Go online web seminar for the topic Handling Non-Conforming Product. This is Sarah and I'm going to be your host today. Thank you all for making it today for this webinar. Welcome Tan to Compliance to Go. I would now request you to take it from here. Thank you.
Well, thank you very much, and welcome everybody to our presentation. Let me bring up the slides. Come on, slides. Here we go. Go back to the beginning. So we're talking today about handling non-conforming product. And if you have any questions about a particular slide, you'll notice that in the bottom of the slide there's a slide number. So note the slide number, and during the Q&A session I can go back and refer to that particular slide, and we can discuss the question in the context of the slide. Now, here's what we're going to talk about today. So our outline is we're going to look at the quality system regulation from FDA. This is very important, and it's going to describe the rules that you need to put in place in order to handle non-conforming product that for the FDA. Then we're going to look at some key definitions. Now, it's very, very important that you get the definitions clear. There's a lot of them in this area, and they're not always as you might expect them to be. And so that's one of the reasons why we're going to spend some time at it. Now, then we're going to look at control of non-conforming product. What does all of this mean? And once we have our non-conforming product under control, we're going to review it to find out some things and then decide what to do with it, which is going to be a technical term called disposition. So we're going to talk about review and disposition. That's going to lead us into corrections and corrective actions. Now, the dispositions are going to turn out to be corrections. The corrective actions are going to be oriented in a particular way that we'll discuss. There is a requirement in QSR to do a data analysis. So we're going to look at that requirement and see how it fits into the system. Now, FDA investigators come and to your facility and perform inspections, and they follow the quality system inspection technique. So we're going to look at some of the things that the investigators will be asking about when they get into this area of your quality management system. Then we'll do summary and conclusions, open it up for questions. All right, so in addition, there is a checklist that you can download, and I put the checklist together with the idea that it's going to help you get an effective implementation. And so that, as well as some of the other material that we're going to look at in the presentation, should give you an effective system for handling non-conforming product. All right, so let's look first of all at the quality system regulation. So this is very interesting because there's a lot of things that are going on. So QSR was based on in the 1994 version of ISO 9001. This version had 20 quality elements. ISO 13485 had not yet been issued. It was still in draft, and it has all kinds of additional information about how to apply ISO 9001 to medical devices. Now, what's important to realize is that ISO 9001 and 13485 have undergone major changes, moving from the element approach to the process approach. And the most recent change, of course, is that there's a new version of ISO 9001 that came out this week, and a new version of ISO 13485 is in the works. It's not clear when it's going to appear. It may be by the end of this year. It may be by the beginning of next year. But what's really important is that in terms of QSR, it has never been updated. So it remains in this area in particular the way it was in the late 90s. So it's still based upon the 1994 version of ISO 9001. There's been some minor technical changes. The only thing that's changed significantly in QSR is unique device identification, and that's not anything that we're going to talk about in this presentation. Now, when QSR was published, FDA published it as a draft, and then they invited people to comment, and they responded to the comments. And those responses are in a document called the preamble. And it is available on the FDA website. And it's really, really valuable because it explains some of FDA's thinking at the time. And so that's going to help us understand what they were thinking and what their expectations of you as a device manufacturer might be. The other thing we're going to look at are warning letters. And warning letters are really, really important because they tend to be the current thinking of FDA. And the reason why we want to put warning letters in here is that you want to learn from them. These are mistakes that other companies have made. And so one of the things that you want to be interested in is making sure that your quality management system doesn't have some of the same problems. So the warning letters are going to be very important to us. Now, I always recommend that in these webinars that people look at the warning letters and ask yourself two questions. Could this happen in my quality management system? And if no, explain why not in a brief paragraph. Write it down. I find it helps clarify your thinking if you force yourself to write this down. Now, you don't have to give it to anybody to read, but it's going to help. And then the second question is, if it were to happen, where in my quality audit program would I find it? So again, a short paragraph explaining what audit checklist item, what interview question would address this to make sure that you don't have these problems. So one of the things I always worry about when I look at these warning letters is to ask the question, why is it that the FDA investigator was able to find the problem and the company didn't seem to know that the problem was there? And so I always question the effectiveness of the internal audit program. Now, as I said, we're going to look at some key definitions, and there are some of them in QSR. A20.3 covers definitions. QSR was built on ISO 9001, and so those definitions contain a lot of insight. Now, the document that has all of the defined terms is ISO 9000, and the most recent edition up until this week was the 2005 version. The new version got published this week in conjunction with the new version of ISO 9001. But we're going to use these older definitions. Now, what does establish mean? We're going to see this all through the discussion about quality management systems. Establish in FDA terms is to define, document, and implement. And so what FDA is saying in the preamble, paragraph number 24, they use the word establish when documentation is necessary. And they're premising their belief, which is the belief from ISO 9001, that written procedures implemented appropriately are going to help assure safe and effective devices. So they're going to be very strongly interested in documentation. And so the word establish, every place you see the word establish, it means you need to have procedures, work instructions, defined methods to do this. Now, it's an interesting thing. This is in the late 90s, you got to remember. So there's this phrase, in writing or electronically. At the time, there was a big question about whether or not you could use word processors in the quality management system, and FDA is saying, no, we don't care what the media is. It could be in writing, could be electronically, doesn't make any difference. We're interested in the content and making sure that it's correct. So every place you see the word establish, you should have procedure. Now we're talking about non-conforming products. So what is a product? Components, manufacturing materials, in-process devices, finished devices, and return devices. Now, FDA has added the definition of product to conform with ISO 8402. This was the dictionary at the time. It's been subsequently replaced by a couple of versions of ISO 9000. And so they're just going to use the word product throughout, but it means components, manufacturing materials, finished devices, return devices, all of that stuff. So we're going to be interested in non-conforming product, and so what we need to do is realize that the word product is pretty broad. It might be broader than what many people come to think. Now, there is this very important word, component. It's any raw material, substance, so on and so on, that's intended to be included as part of a finished package and labeled device. Normally what's going to happen is the component is going to be the thing that you buy, or it could be a subassembly that you make. It's not a finished device, but it's going to go into a finished device, and you intend that it's going to be in a finished device. So